This is not the judgment zone over here. This is let's find the most efficient cost and access to coverage that you need within your financial resources. That's it. That's the standard. There's no second. Thank you very much for joining. My name's J.O. I am the author of Maximize Your Medicare. That is what people pigeonhole me to be. That said, those persons who are subscribers to the Substack, they're the address there in your lower right-hand corner, will be very clear to you. The fact of the matter is that health insurance matters are about a specific topic. There's tons of jargon and all these other issues, but it is really about your common sense and logic, and then how it applies to your specific situation. And from there, do I have professional services? The answer is yes. And this isn't, an infomercial by any means. That all said, of course, you can bring private questions to us. We'll be able to handle it. Your PSA right from the beginning is always those persons who are on Medicaid, there's never a charge for any reason. Okay, we will help you. Absolutely. Medicaid, very complicated, whether that be pre-Medicare or Medicare, vital spot. That every dollar represents groceries. I'm sensitive to that. Got lots of clients like that. We're happy to do that. That's the least that we can do to give back to everybody. So even if you're a person of a lot of means and comfortable living, you'll know someone a stone's throw away, whether that be, as close as a sibling, whether that be a friend, a neighbor, your community group. If they have questions regarding Medicaid and how they are linking to health insurance matters, absolutely, we would be happy to provide guidance, and all fees in every situation for that audience is waived. By all means, please do that. That would help not only that person, of course, primarily, that will help us all. I'm very convinced of that. We're not going to a situation where, we're going to have, national health care. We're not going to go to a situation where, just set them out on a limb and let them fend for themselves. It's their fault. I'd rather deal with practical reality. So two big segments here today. We're going to get to financial markets as the second segment. The first segment here is a couple of headlines here on Medicare and health insurance. Important ones, I would say. Medicare Advantage versus Medigap is going to continue to rage as a debate. I just don't see any way around it. 50% of 65 million Medicare Advantage of some sort. That can be your retiree plan. That can be your individually purchased or obtained Medicare Advantage. You're going to see lots of negative on Medicare Advantage. We're also not going to get around that. For many people that are not standing behind a pulpit, okay, of the way the world should work, the way the world has to work. This is different channel. Please, different channel, right? It's not that every specific sentence of the objections are wrong. There can be elements of truth. I'm going to review them here in this first segment. Nevertheless, to the person when in an environment of $5 gas and Social Security being your only income, of which is a very large percentage of the population, $0 for PPO Medicare Advantage is of huge, huge benefit, especially under this particular situation. I don't have a crystal ball. $5 gas isn't something that's going to go away easily. So back to our common sense. All the headlines are usually based on negative, and I get all that. That is our society. That's our number one national pastime, not the NFL, right? Which is find someone to blame. That's our national pastime. Find someone else to blame. And of course, with 30 million people on Medicare Advantage and with healthcare costs being well over 10% of the GDP, of course, it's an easy identifiable rock or target for the rock to throw. And here you have it here. This is just the other day, literally the other day, this article is posted. And the essential MA program is evaluated fairly, and an appropriate funding mechanism continue to be available to ensure that millions of seniors and people with disabilities who rely on MA plans continue to receive high quality coordinated care they deserve. This is a statement for a hearing on the House Committee on Energy on Medicare Advantage oversight. You can see throughout YouTube prior authorizations on Medicare Advantage. That is true. For those persons who are new to Medicare Advantage, under Medicare Advantage, you do have this party that intervenes, and that is the carrier. The carrier has the right to deny a particular healthcare service. If approved, then you follow the printed copayment coinsurance schedule. The issue here is that this report and the other person say there are all these denials. I don't want to overstate the denials, right? Meaning that, it's going to look like, $1 billion, $10 billion, or lots of services denied. Okay. That is going to exist. What's also going to exist is the fact that this is on a percentage basis. And this is correct. Also correct. The report highlighted improvement in prior authorization approvals. This stuff is glossed over. You see what I'm saying? I mean, let's not call this just one-sided. Here, however, is some matters that I do want to address. MedPAC report found that Medicare Advantage programs' risk scores are higher than original Medicare and suggests it leads to higher payment for Medicare Advantage plans. This is the part that should be getting the headlines. The reason the Medicare Advantage plans can be zero, the reason that you can find Medicare Advantage plans at $0 premium is because of the way that the CMS, the federal government, pays an allowance to Medicare Advantage carriers. That's the path. Every month, these guys send money over here. It's kind of, I do explain it, to people as an allowance, kind of like you've given your child an allowance, a monthly allowance, and they go and spend it on whatever it would be. That could be, bubble gum, big gulps, comic books, video games. Maybe I'm talking about my own childhood, right? The issue is that the CMS pays a higher allowance for the persons who are sicker. And this is why you get encouraged to take a risk assessment, welcome to Medicare Advantage call survey. This is the reason. It's because this group here is then reporting to the allowance payer, hey, this person, Mr. Sick-a-Lot is a policy owner. And therefore, this group over here pays the Medicare Advantage carrier a higher allowance. And this is what this article is talking about here. That's the mechanism by which the higher payments from the CMS go to Medicare Advantage players. Accusations of fraud, risk adjustment, or inflated risk adjustment. If systematically true, this is a problem, because that would mean that this group here is overpaying this group systematically. So there are boundaries, right, which is medical loss ratio. These guys have got to use 85% of allowances collected on claim. If this group is overpaying systematically here above and beyond that, it's supposed to be returned in MLR space. Whether or not that's occurring correctly, I'm not in place to judge. But let me just also say that, could there have been workarounds for this? I think that this is a very sticky wicket, meaning that it's going to be very difficult to prove that these persons over here are overinflating. Very difficult to prove that they're doing so willfully, systematically, right? The carriers are smart, right? I don't think they've, as I like to say, unlimited computing power, unlimited legal resources. So to be able to say that this payer is paying excess amounts, I'm not even sure if I have the arrows directions correct, that they're overpaying systematically, and to be able to prove it is a different matter. I pointed out in the video on the Maximize Your Medicare channel, which is something about the Supreme Court and the overpayments, right? The ripple effects are so massive that if you continue to have pressure on the Medicare Advantage carriers, that's okay, right? But it's walking this thin balance, because that extra money over here is being deployed to a number of different things. Number one, superior prescription coverage. right? It's very clear what has happened to me. I'm a practitioner, right? I am comparing for our client base Medicare Advantage versus Medigap versus, prescription drug plans across the board, so that you can say, so that we're comparing overall costs for clients. Jay does not care what your background or how we got here, right? This is not the judgment zone over here. This is, let's find the most efficient cost and access to coverage that you need within your financial resources. That's the metric. That's it. That's the standard. There's no second standard. And what I'm saying, it's very, very clear what the smart guys in the room, Medicare Advantage carriers, have done. They've taken the extra allowance. They've used it to enhance the prescription drug coverage. They've used it to add vision. They've used it to add preventative dental. They've applied, as required by regulation, the out-of-pocket maximum. There's no getting around these factors. So the people throwing rocks at Medicare Advantage, those are going to be the cuts then if you push down the monies to the allowance. You can see basically how complicated the web is. So now we're here for pre-Medicare. When COVID struck the nation, a public health emergency was declared. The public health emergency stopped the Medicaid audit process. It has been scheduled to end, the public health emergency. If that ends, there's going to be a waiting period, and then from there, persons can be ejected from Medicaid. If someone is ejected from Medicaid, you have a special enrollment period into the Affordable Care Act. Please share this with persons. It's a lot of moving parts. I absolutely understand. I've got this unenviable task of speaking slowly so people can understand it, and clearly speaking quickly enough to not, because I don't want to use up 7 hours of somebody's day when it's 75 and cloudless outside here in Michigan, throughout the state of Michigan, where I'm broadcasting from today. This will create havoc. There's no getting around this. This will create havoc, because you still have a sensitive world to COVID and persons still getting COVID. The second one is, many persons have taken full advantage. Congratulations to you. I'm not talking about full Medicaid. And it's unfortunate that Medicaid expansion has the word Medicaid. It's wrongly named. The health insurance subsidy under the Affordable Care Act is called Medicaid expansion. This is the APTC, which is the Advanced Premium Tax Credit. This is what has allowed lower health insurance premium, right, for persons. And it has been huge. It has been huge. Up here is the screen. I've shown this on other videos throughout Jay's Corner, throughout the Maximize Your Medicare channels, both, and throughout the newsletter, which has basically been able to tell persons that you can estimate what your lower health insurance premium would be. That said, if at the end of 2022, the degree of the subsidy is set to decline, and notably. And this becomes the issue because it has financial planning implications. Here we are. Now you can see my world and what I'm actually doing. And this is a spreadsheet that it has no name. Okay. And it doesn't matter what the person's age is. But what I'm saying here is it affects this cell here, which is BBBB. And you can see it here. I've now placed it in red. This number is so big. If you're in Tampa, Florida, you're 55 years old. This is $1,000 a month is the sticker price. Easy. Easy $1,000 a month. The APTC, the Affordable Care Act, the Medicaid expansion has driven this down by $10,000 a household in a year. Absolutely the case. So you can imagine what this has done in terms of helping household finances. And right, this is just, I've set this at 64. This could be 54 very easily. Right, this is just a simple example that I'm using for, illustrative purposes. Right, so now we're 54, and now all of a sudden it doesn't matter what your age is. This number here has been improved in many households by 5 digits a year. We're going to have to unfortunately, you're going to have to do is you're going to have to look at this. You're going to absolutely have to look at this because of the fact that this information here is this degree of savings here is creating a problem because of the fact that what you're going to have is you're going to have a situation where BBBB is the cost, your expenses up by thousands of dollars a year if the Build Back Better Act isn't adopted or is the existing ARPA, which is the American Rescue Plan Act, expires. If this stuff expires, this number here will go notably higher for a lot of people precisely at the time that gasoline is now $5 a gallon, precisely at the time that mortgage rates have gone from 3% to 5%. So you can see it, 3.5% here, 1468. 5.5% here, 1781. So basically what would end up happening is you're having this ripple effects of costs here on expenses, creating a great amount of duress. And I'm going to call it the fourth inning. We're going to get to it very, very shortly within 2 minutes, right? I'm going to call this only the fourth inning. The turmoil in financial markets, the volatility in financial markets, the effect that $5 of gas is having on people, even if you're not invested, you don't have savings, you don't have a 401k IRA. Even for those persons, we're going to have this ripple effect here on household balances. We've had tremendous destruction, erosion, whether that be gradual or sudden, right? And the ripple effects of it are still unknown. That's why I'm only calling this the fourth inning. I'm only calling this the fourth inning. We cannot possibly be anywhere near a conclusion or understanding exactly what the full set of ripple effects is.